dermis. And when you get into the dermis is when you start to see real rejuvenation and change. Our dermis rebuilds itself, and it rebuilds itself with fresh collagen. So the things that make us age are loss of collagen, loss of elastin, and loss of volume. So anything you do that brings the skin back, you damage the dermis a little bit and it heals with fresh collagen, things are going to be fresher. Our epidermis is sloughed constantly, so it's just kind of in our way. So you get that out of the way and you address the dermis. The deeper the trauma, the more the change. But that's where we decide what a patient is ready for, what they need, and how much downtime they can accept. Welcome to Plasticos, the everything you ever wanted to know plastic surgery podcast with me, Dr. Christopher Park, and host Kim Anderson. We will discuss surgical and non-surgical plastic surgery options and the ways that they improve your health, mood, personality, and success.
Welcome back to Plasticos. I'm Kim Anderson, joined here with Dr. Christopher Park, and we're answering every question you have on plastic surgery. Now today, we are talking about non-surgical procedures. Dr. Park, you have what you call the med spa that addresses a lot of those issues. Tell us a little bit about that.
Plastic surgeons do surgery and non-surgical stuff, but I decided to have its own little entity, Med Spa at the Park, which addresses things with both technology as well as hands-on treatments. You know, there's certain things that the estheticians do, such as facials and peels, and we have some, awesome things that you should just do routinely, like HydraFacials that are a great way to just cleanse the face. And then we have physician-directed stuff, which are like we do our own, all the injectables, whether it be a neurotoxin. People know the word Botox, but there's other ones. And then fillers, which are things to volumize in different ways. Those the physicians do. Physicians also do any real aggressive lasers that are meant to resurface and really take some years off with the skin. Aimed at wrinkles, I mean, we have lasers that target dark spots, hyperpigmentation, melasma, lentigines. Their goal is to target those browner things and pull them out of the skin, and they actually ultimately flake off a few days later. And then there's, the less invasive procedures the estheticians do, kind of just maintenance for your skin.
Now let's talk about some of these procedures. And I guess first we're going to talk about Botox, because you hear that all the time, and people are thinking you're injecting poison into my skin, but it's really not the poison. And how does it work?
Yes, it is botulinum toxin. So it is the toxin that causes botulism, but it's probably a 1/1,000,000th of the dose that you would need to have a physical problem. As the company's glad to report, it's an amazing little drug. I mean, it blocks the synapse from releasing. So there are certain things we can treat, and you can relax muscles that we don't need, and wrinkles specifically that cause wrinkles. Mm-hmm. You can also treat a variety of other things. You can treat glands that make too much sweat. You can inject them with these and they block the release. But most people think about it from the wrinkle perspective. So, knowing the anatomy of the face, there's certain muscles we know that we can relax that aren't going to make you look like you had a stroke. I mean, these are muscles you don't need that will smooth out your face. And with those injections, they last about 3 months. There's 3 different types right now. They're always trying to research more, and there's one coming out that's going to last longer. We know what muscles we can treat to smooth things out. So there's certain muscles you inject for the forehead, certain muscles you do for crow's feet. There's a muscle called the depressor anguli oris, which below the mouth, which you can inject to cause the corner of the mouth to turn up a little bit. There's lots of things you can inject. Bunny lines on the nose. Everybody has a different need, and it's just a cool little drug. You do a little injection with a very tiny needle, and it starts to work over 2 to 7 days. And as long as you don't put it where you shouldn't put it, you don't have any problems from it. There's no risk of the toxin being a systemic effect.
And we know that'll take years off you when you're talking about wrinkles on the forehead, crow's feet, and I'm thinking the bunny lines, that's the little wrinkles right in the center of your nose.
Top of the nose, yep.
And you see so many people who do have, they're happy people, but their smiles are turned down and it almost looks like, they're frowned and they're not.
Correct. And really, even a facelift doesn't change that. So we use the neurotoxin a lot. And then I'm a very big fan of not a super well-known procedure, but a corner of the mouth lift. There's a little procedure you can do even awake under local anesthesia that kind of turns the corner of the mouth up. Because yes, you can have some very happy people look very unhappy every day. And it just looks like they're scowling or pouting. And the neurotoxin, if you can get that little muscle, it's a wisp of a muscle. It's tiny, but if you get it, it'll turn up just a couple of millimeters. It makes a big difference.
A big difference. Now let's talk about some of the pills. And we're talking about it literally kind of almost takes off your skin, the top layer.
Yeah, most peels are based on an acid. And it's a huge topic and there's a bunch of different peels, but essentially you're doing a controlled level of an injury is the word I like to use. Some people would say it's a burn. It's kind of like a burn, but it's at a very controlled level. And what you're doing is you're taking off the epidermis, which is the outer layer of skin, and you're getting variable extents into the dermis. And when you get into the dermis is when you start to see real rejuvenation and change. Our dermis rebuilds itself, and it rebuilds itself with fresh collagen. So the things that make us age are loss of collagen, loss of elastin, and loss of volume. So anything you do that brings the skin back, you damage the dermis a little bit and it heals with fresh collagen, things are going to be fresher. Our epidermis is sloughed constantly. So it's just kind of in our way. So you get that out of the way and you address the dermis. And different peels go different depths. I mean, the more superficial peels that you're going to heal from faster aren't going to do as much change. But we'll use those more superficial peels when you don't need as much, or if you're younger, or if your skin is darker. We do those sorts of things. And then, it's the same answer with lasers. Lasers is just, instead of a peel and a chemical, you're using a device that has energy targeting certain things. Lasers is a variety of options, and it's hard to get into all of them. But essentially, we have resurfacing lasers, which is lasers designed to do exactly what peels do. But instead of depending upon that chemical, you have a machine or device that does it. The advantage mainly of the lasers is the fact that it is a device. You can get it computerized to where it breaks it up into little micro beams of laser. So with a peel, you're treating the whole surface. You're not skipping a segment. You're not going deeper in one segment. With the laser, you can adjust every pulse, go weaker or stronger, and you can also target it to where it's broken up into little beams of light. So you can go deeper in those little beams and have the normal skin around it to help heal, where if you went that deep everywhere, it would take 8 to 10 weeks to heal.
And how long? I mean, because this is not something that, if you try taking out the top layer of your skin, that you can be back to work like the next day.
Correct. If somebody really is just trying to get the skin healthier and really not have any downtime, that's when we're going to do something like a HydraFacial. It has a very weak peel in it. It's pulling off the dead skin, but it's not really causing deep trauma. The deeper the trauma, the more the change. But that's where we decide what a patient is ready for, what they need, and how much downtime they can accept. When we do the more aggressive peels, it can take a week or so to get over it. And you still may be red at that point, but you can cover it with makeup once it's healed. So the more superficial peels get over, a couple of days, 2 or 3 days, and you'll have some sloughing, you'll have some dark spots that kind of fall off. But the more aggressive peel, like a laser, like a CO2 laser, that's the one that physicians do. I do myself. And, it takes a week to heal, and then you're still red for 6 weeks or so.
Now let's talk about some of the other procedures that you can do that the spa offers. Collagen and collagen injections, and everybody's into these injections. Exactly how do they work? We're going to start with the lips because that seems to be very popular right now.
Well, you dated yourself a little bit because we don't actually use collagen anymore.
Oh, okay. I'm sorry. I'm old.
No, collagen is what we did at first. And you had to get allergy testing. You'd have to come in and get a little wheel and make sure you weren't going to react to it. And then you were injecting collagen. Usually they're made from rooster feathers, from the comb of the rooster. But now there's a variety of fillers, but the most common fillers are hyaluronic acid. Hyaluronic acid can be manufactured, doesn't have to come from an animal, and it is in our skin normally. We all have hyaluronic acid in our skin right now. So there's no risk of an allergic reaction. So there's nothing to fear on that end. And then the question is, how much do they cross-link that hyaluronic acid? And the more they cross-link it in the manufacturing level, the longer it's going to last and the thicker it is. So now at this point, we have a whole menu of options. And I'll use a different type of filler in the lips than I do in the cheeks, than I do in the folds around the mouth. So many options, and it's amazing. It's very powerful. So most of them are hyaluronic acid, but we also have some other ones. Like I really am a big fan of calcium hydroxyapatite. Trade name is Radiesse. It's basically the equivalent of being ground up bone, and it's bone. It's not really bone, but it's the same product, calcium hydroxyapatite, and so it lasts longer and it's thicker and it's better for deeper folds. So like the folds around the curves around the side of the mouth, or somewhere that you need volume. And then there's polylactic acid, which is trade name is Sculptra. There's a variety of fillers that we use for whatever we think we need it for. And it's really amazing. It's almost gives you multiple size brushes to paint with instead of having one brush.
Now, what is the purpose, I'm sure a lot of people, because we're almost out of time here, that goes by so fast, of the fillers? How do they help your face?
We use the word fillers, but to me, there's fillers and there's volumizers. So we can make somebody look younger and lift the other parts of their face by adding volume where we want volume. So most main examples, the cheeks, the cheek pads, the malar eminences, the high-riding cheekbone outside your eye. A lot of people don't have it. And if you add to it, it's actually going to pull the center portion of the face out a little bit. And then there's also fillers where actually going in a specific wrinkle or a fold. So wrinkles are like the fine wrinkles around your mouth or between your eyebrows or wherever, and you actually want to plump that line up and fix it. Versus, also we'll just add volume diffusely, like in the lip, to make your lip more full. But the nice thing about like I said, is these are natural now, and we can use them kind of however we want. You're just kind of putting them where you need them to fill in what happens. Because 3 things happen with age. One is loss of elastin, loss of collagen, and loss of volume. The volume we lose in our face is both our bones literally do shrink over time. I mean, we have studies where we've done CT scans of people every few years for years, and the bones get smaller and smaller and smaller. So it makes the skin look like it's sagging and hanging. You also lose fat a lot of times as we age. And those things just give your skin envelope less place to be. So that's when they start to sag. So you're adding volume back.
Can we, like we talked about the fat removal and placing it everywhere, can we place the fat from out of our other body into our face?
Absolutely. Facial fat grafting is one of the first places we really started fat grafting. And you were doing small amounts. We treat it very differently than we do when we do larger areas like breasts or buttock. Absolutely. The only problem with fat is that compared to our current products, when fat first came out, we didn't have all these great injectables. So it's a little bit inconsistent. Like you may put in 2.5 cc's on left cheek and 2.5 cc's on the right cheek, but only 1.8 lives on the left and 1.4 lives on the right, and that can end up looking a little bit different.
So your face will be lopsided. A
little bit. Can be. I mean, you can always touch it up, but that's the advantage of these manufactured fillers. They're very, very predictable. But if somebody needs a lot of volume, then we do oftentimes recommend fat, because a lot of volume with filler is expensive. You're paying per syringe. I mean, and it's expensive stuff. So yes, occasionally I do fat grafting to numerous spots, especially if and sometimes I do it when I'm doing surgery. If I'm doing a facelift, I can add volume to the cheek pads and around the mouth and those sorts of things. You just have to be a little bit more careful with it. It's less forgiving. It can be, it's fat, so it can be a little bit clumpy. If you're using it somewhere thin, like in the eyelids, we don't like to do that as much anymore. I mean, it's great when it works, but you can get some unpredictability.
All right. So if somebody wanted one of these treatments, they have to make an appointment, and you, of course, got the med spa right there. Yeah.
I mean, we get people that walk in off the street, but opportunity or availability may not be present. So absolutely make an appointment. They're not all physicians, so it's easier to get in. We've got 3 estheticians that can help people. They all have their own little areas of expertise, and we'll be happy to set that up for them. So you just do it either by walking in, calling in, or emailing.
All right. We could talk about this all day long, but we are out of time, so we have to wrap up this podcast. Thank you so much. Again, give us the email, the web address, and the phone number where people can get in touch with you and ask you specific questions.
Absolutely. The easiest ones are info@mprsd.com, which is the website, mprsd.com, and phone number 251-340-6600.
All right. Thank you, Dr. Christopher Park.
Thanks for listening to Plasticos Podcast. Please follow us on our Facebook page, and please rate and review Plasticos on iTunes and anywhere else you get your podcasts. This really helps others discover this show. Have a plastic surgery question you want us to talk about? Contact us on our Facebook page or email me at drpark@mprsd.com. That's drpark@mprsd.com. Plus, we really want to hear what you think about our episodes, so let us know. Thanks again for listening, and remember, insist on credentials, invest in results.